Hello everybody! So this is my presentation on ECT, or electroconvulsive therapy. I chose this for the project because I just think this is a super interesting therapy that we don't know a lot about, especially people who are going into healthcare. We don't really learn a ton about this, so thought it would be interesting to learn about. So what ECT is, when you go in for an ECT, electrodes are connected to your head and used to send a small electric current through the brain for about 1 millisecond. And that results in a seizure that lasts about 30 seconds to 1 minute. So in this picture, you see this woman has the electrodes connected to both sides of her head. And she is also connected to an EEG, which monitors brain wave function. So it can tell you that she's having a seizure. So it's used to treat mental illness, and the mental illnesses that it treats are severe depression. That's the one that it is most effective for. It also treats bipolar disorder, schizophrenia, severe mania, and catatonia. And these are mental illnesses that often occur together, especially when they're very severe. It's most often used as a second-line treatment. So when medications aren't effective or when you need to enhance medications in all sorts of populations, or for people who are unable to tolerate certain medications for whatever reason, or for pregnant women. It's safe for pregnant women if you're postpartum or breastfeeding. If you're a geriatric, in the geriatric population, it's safe for all of these different people. And it can be an inpatient procedure or an outpatient procedure. So most people can, all people go home at the end of the day once it's done. Okay, so there is definitely a huge stigma attached to this procedure because originally it was done in a really inhumane way. I think in the 1930s, they would basically just send a huge current through your head and you wouldn't be under anything and you'd seize, and there were reports of people breaking bones and really hurting themselves, which is awful. But now they do it in a much more humane way. They put you completely under in general anesthesia and then give you muscle relaxers so the patients don't feel or remember the procedure. And then they know you're having a seizure because they monitor brain activity using an EEG. And they can also put a blood pressure cuff on your foot, which blocks the muscle relaxers from reaching your foot. So you can see the seizure in the foot. The foot will be twitching if they do that. Okay, and then ECTs can be unilateral or bilateral. So unilateral, they would attach an electrode here and here, and that just affects the right side of your brain. And then bilateral, it's just here and it gets your whole brain. And then there are side effects, including muscle soreness because you did have a seizure. Headaches are common, nausea, and memory loss in some cases. Johns Hopkins has done research on reducing memory loss, and if you reduce the amount of time that you send the electric current through their head, so less than a millisecond, the memory loss is extremely reduced. And this therapy is usually conducted 2 to 3 times per week for about 4 weeks. So this can result in 8 to 12 sessions of ECT, just depending on how severe your mental illness is and how you respond to the therapy. So no one is exactly sure how it works biologically. They think it may change the way brain cells communicate at synapses or flood the brain with dopamine and serotonin, but we do know that it does work in most cases. According to Johns Hopkins, these treatments improve depression symptoms 70 to 90% of the time, which is more than some antidepressant medications. Okay, so the physics of ECT. So ECT utilizes alternating current in very small bursts to induce a seizure. And then they use electrodes as well as electrode jelly to conduct the current. The electrode jelly is applied to the pads first to protect you from burn because the high voltage could burn your skin, but when you have the jelly, it doesn't burn it at all. And then it helps to conduct the current through the skin as well. And then the voltage varies. It can be anywhere between 200 and 450 volts under 1 amp, and then the 500 to 1200 microcoulombs of charge. And I just thought this was an interesting image showing you the voltage of different machines that are utilized in the UK, in the US, and in Europe. The picture on the right is one that's used in the US. I think it's the 240 voltage one. Just thought that was interesting. And then another therapy that is very similar to this one that I discovered when I was looking up ECT is transcranial magnetic stimulation, which applies to our class because it uses a magnetic pulse to induce an electric field in the brain, and it's a much milder therapy, and it can be done daily for 4 to 6 weeks, and it's used to treat milder cases of depression. And it's a newer therapy, but it's been shown to be pretty effective. So in conclusion, this is a revolutionary treatment that utilizes the relationship between physics, especially the principles of electricity, to enhance brain function and provide relief to those suffering from severe mental illness. So it's a really cool therapy, and you should look it up if you are interested.